Hi, welcome to HIM 5106, and this is Module 6. We'll talk about patient-driven and community engagement initiatives for population health, including mHealth, which is mobile health, open data, data liberation, and community data, and crowdsourcing, social media, and engagement. Our learning objectives for this module: to understand how building and using informatics systems can promote and improve the health of populations, and to understand how to identify and follow good data principles, and using data to understand and manage the health of patient populations. Please be sure to read these pages in your textbook, this current news article, this peer-reviewed article, and please find a source that will summarize this new government proposed rule from the Office of the National Coordinator. Let's start with patient-driven and community engagement initiatives. We've often heard that the patient is the most underutilized resource in the health system. Patient-driven healthcare can be categorized as having an increased level of information flow, transparency, customization, collaboration, and patient choice and responsibility taking, as well as quantitative, predictive, and preventative aspects. Now, this does not imply that patients are taking over for clinicians. Patient-centric is an older term which is still in use today, and some people believe it implies that clinicians are in charge even though the patient is at the center. There's another term, patient-driven, which means that the patient is truly in the center. We have been talking about patient-driven healthcare for 30 years. Please take a look at this journal article, and you can see that back in 1990, we were talking about patient-driven healthcare, and we still truly aren't there yet today. There's also the story of Jess Jacobs, an informatics professional, who wasted 20% of her valuable time and then she passed away. You can read these stories and information by going to the static PowerPoint link and going into the slide and getting those links to read. They will also be posted as separate links in Canvas. Moving on to mHealth. Mobile health is a general term for the use of mobile phones and other wireless tech in medical care used to educate consumers about preventative healthcare services, disease surveillance, treatment support, epidemic outbreaks, the tracking of those, and chronic disease management. In April 2019, the Food and Drug Administration targeted do-it-yourself mHealth devices that are aimed at concussions and head injuries that do not perform a diagnosis by a clinician. There's also little evidence that the majority of mHealth apps are even effective. Out of the hundreds of thousands of mHealth apps on the market, the effectiveness of only 22 have been evaluated in the last decade, per a study recently published in Nature. mHealth apps' sharing of user data with third and fourth parties could also jeopardize patient privacy. And yet, mHealth data from wearable devices and patient monitoring tools could increasingly feed artificial intelligence, machine learning, and predictive analytics technologies moving forward. Open data, data liberation, and community data. Free the data. In February of 2019, CMS Administrator Seema Verma laid out a plan for the digital data revolution. This new proposed mandate from the Office of the National Coordinator is for consumers to have immediate electronic access to their health record, including through their smartphones, using the application of their choice to view the data. This was a call for insurers to also share claims data. As Verma said, let me be clear, the idea that patient data belongs to providers or vendors, such as EMR vendors, is an epic misunderstanding. Patient data belongs to patients, or at least it should belong to patients moving forward. As drafted, the proposed rule on information blocking requires that insurers share patient health data with patients by January 1st, 2020. As ONC moves to increase interoperability with this information blocking rule, they must also collaborate on health, Internet of Things, and medical device guidelines to ensure that providers do not introduce any new risk. Crowdsourcing, social media, and engagement. Transforming the healthcare industry through the application programming interface marketplaces. A key problem in the healthcare industry is that valuable data points are hidden and siloed, even though these data points many times have been generated by the population, and yet the same population does not have access to that data. Here's an example of a snippet from a crowdsourced dataset. It's from Twitter, and this Twitter dataset collected patient-reported adverse events or symptoms using the drug Claritin. This data was then put into a visualization using Flourish Studio. And in this visualization, you can pick and choose how you want to group the data. You could group by gender. And please note as this opens that the data is not perfect. Once you group by gender, you could also group by, we'll say, headaches, and once the headache data comes up, yes or no or blank, you could then shade by gender. To slice and dice the data and look at it from various population viewpoints. Please be sure to look in Canvas at the following activities that are due during this module. Thank you, and if you have any questions, please feel free to reach out using the email functionality within Canvas.